All right, today we're going to do something a little different. We're going to solve a medical mystery together. So put on your clinician hat. You've got a patient, a really confusing set of symptoms, and a few possible culprits. It's up to us to follow the clues, connect the dots, and figure this thing out. Ready? Let's dive in. Okay, so here's our case. A man comes in, he's having a really hard time breathing, and he's got a fever. He's also emaciated, dangerously thin and weak. He's got a cough, and then there's this really unusual thing, these distinct purple blotches all over his trunk. Right off the bat, what are you thinking? Let's line up the usual suspects. You know, any good diagnosis starts with a list of possibilities. It's what doctors call a differential diagnosis. So based on what we're seeing, there are really four main culprits we need to look into. And here they are. Could it be tuberculosis, pneumonia, maybe HIV/AIDS, or even hepatitis? See, what makes this so tricky is that any of these could explain some of the symptoms, but our mission is to find the one diagnosis that explains the whole picture. Okay, now the real detective work starts. We've got to break down these symptoms piece by piece and figure out which clues are general and which ones are specific. But we immediately hit a roadblock. And here's the problem. So many of these symptoms overlap. Think about it. A fever, a cough, weight loss. It's all just so frustratingly nonspecific. It's like the body is shouting that something is wrong, but it's not telling us what. Let's just look at the list. Weight loss, that fever, the cough, fatigue, night sweats. Sure, these could be signs of advanced HIV, but they could also point to a really bad case of TB or pneumonia. If we only rely on these symptoms, it's like trying to identify a suspect from a super blurry photo. We need something clear. We need a smoking gun. But this is where everything changes. In this whole mess of overlapping symptoms, there's one clue that just doesn't fit with the others. It's the one thing that stands out, and it's about to change the entire investigation. And this is it, those purple blotches on his skin. See, all the other symptoms could send us down a dozen wrong paths, but this is different. It's a huge, flashing sign pointing us in one very specific direction. Because you see, these aren't just random blotches. There's something much, much more specific. Yeah, we're not talking about a simple rash here. This is a type of cancer called Kaposi's sarcoma. And these lesions, they're almost always, always, linked to one thing and one thing only, a seriously weakened immune system. And just like that, with that one fact, the whole case just cracks wide open. Okay, so we've got all our evidence on the table. We have the general confusing symptoms, and we have our one crucial, game-changing clue. It's time to put all the pieces together and nail down the one diagnosis that explains everything we're seeing. The condition that best explains this entire presentation is HIV/AIDS. It's the only one that perfectly fits the whole complex picture. But let's ask the question. How does it connect all these seemingly random dots? Okay, let's just walk through it. The emaciation, the fever, the cough, classic signs of advanced HIV disease. The breathing problems, that's probably pneumonia, right? But it's a special kind of pneumonia, one that could only take hold because the immune system was so weak. And the purple blotches? Well, that's the Kaposi sarcoma we talked about, which is triggered by that very same weakened immune system. See? Every single piece just clicks into place. And just to be absolutely sure, let's quickly rule out our other suspects. Tuberculosis? Nope, doesn't cause these lesions. Pneumonia on its own? No way. Hepatitis? Not a chance. Those purple blotches really are the key. They're the one thing that lets us cross every other possibility off the list and lock in our diagnosis. So we figured out the what, it's HIV/AIDS. But to really get it, we need to understand the why. Why does this one disease cause this whole waterfall of different symptoms? It all comes down to one core idea. And that idea is immunosuppression. Basically, advanced HIV goes after the body's immune system, just hammering it and weakening it until it can't fight off anything. It's like a castle suddenly having no soldiers, no walls, no defenses. Anything can just walk right in. So here's how it happens, step by step. First, you have the advanced HIV infection. That leads to severe immunosuppression. And that weakened state basically throws the doors wide open for what are called opportunistic conditions. Things like that pneumonia and Kaposi's sarcoma, which just jump on the chance to attack a body that can't defend itself. And this is a really crucial point. HIV didn't directly cause those things. It just took down the security system, allowing them to run wild. And here's a little bit of historical context that's pretty powerful. For a long, long time, especially before we had the treatments we have today, these purple lesions were one of the most visible, defining signs of AIDS. It was an outward, visible sign of the invisible collapse happening inside the body's immune system. And really, this brings us to the big takeaway here. In medicine, sure, but really in solving any kind of complex problem, you just can't get tunnel vision on one single clue. You have to take a step back and look at the entire picture, see how all the pieces connect. It wasn't just one symptom that solved this, it was the whole pattern, the combination of everything that pointed to the truth. So let's leave it with this question to chew on. How can one single detail change everything? For our patient, those purple blotches were the key that unlocked the whole mystery. It's just an incredible reminder of how important it is to pay attention to the details and how one specific clue can light up the entire path to the truth.